I'm a neurologist. I got trained from the Institute of Neurology, England, and I'm the managing director of a 350-bedded hospital called Universal Hospital in Abu Dhabi.
And my name is Dr. Haider-Shah. I'm the Chief Strategy Officer at Universal Hospital. I work both in the administration and the clinical side as a consultant in neurointerventional, interventional radiology, and interventional pain management. And we are here to discuss and to kind of go over our views on this new innovation summit that's happening in Dubai. And we're actually very excited to talk about the topic of innovation in healthcare.
That's right.
And this is something that we discuss all the time and go over, and some of the strategies that we come up with when we kind of think of new innovative ways to deliver healthcare.
That's right.
Maybe we can talk about some of the things that we do in our hospital.
That's right. I mean, if you look at United Arab Emirates, especially, let's talk about Abu Dhabi and Dubai. There's a lot of innovation that's happening in all the other sectors. Now healthcare is also a dynamic, it's a very dynamic proposition where, there is a lot of innovation that is required in healthcare. The healthcare requirements, the patient expectations, the cost of healthcare delivery, all those things needs innovation. Without innovation, healthcare is going to be becoming a lot of burden for the providers as well as for the patients. So I think congresses like this, wherein definite focus on innovation is being done, is going to do a lot of good things for the GCC and especially for United Arab Emirates.
And I think this country is moving towards what they call a knowledge-based economy. And the knowledge-based economy requires innovative strategies in bringing both the native population forward and the expat population forward to come together to develop new and innovative ways to deliver healthcare. And as we've said, that there have been some gaps in the past in healthcare, and what our company is doing, or what our group is doing, is trying to fill in those gaps in key ways that have not been done before. Things that are, as we say, we don't mind, and we actually encourage disruptive thinking and disruptive methodologies. We feel that there's a lot of healthcare that has become very stagnant, and there's a lot of silos in healthcare, which there's not a lot of mixing of different strategies and different knowledge bases. And we, I think our company encourages that mixing. We do a lot of cross-functional group training. We have a lot of innovative ideas in our electronic medical record, our EHR, HIS, our LIS. These are things that many other companies have not brought forward.
Right.
I think maybe you could talk a little bit about that.
So I think the most important thing, rather than any of these issues, is the medical efficacy review. What I think is any innovation should not be harming any patient or any doctor for that. That's the most important perspective. Medical efficacy review, if it is done by a group of people or group of doctors on giving importance to patient safety, I think innovations can do big things in the United Arab Emirates. It's a very young country. There's a lot of unmet requirement for innovative healthcare. I think if the medical efficiency review is being done properly, I think we can make in a lot of innovations, especially in healthcare delivery, pharmaceuticals, and whatsoever.
And I think, without giving away all of our ideas, we will talk a little bit about some of the strategies that we have. We want to start giving the patient, or as we say also the consumer, the healthcare consumer, a chance to be more involved in their healthcare. The old model is that it's a very patriarchal model. That the doctor dictates to the patient and the patient does whatever the doctor says. We want our patients involved, we want them educated, we are very involved in prevention. We want to make sure that they are making and getting the best information and knowledge to make that knowledge-based decision on what their healthcare needs are.
That's right. Now, I think the other important thing which I would like to mention is about the misconception that people think are innovation. Many of the things that have been brought into the market are being branded as innovative concepts, but I think few of them are misconceptions, because there is something which we need to take care of. It's called as the regulatory oversight. We need to actually follow the regulators' regulations and then bring in innovations, because this is a safe country wherein innovation should not cause patient harm. And the other thing is there's a very well established product delivery assistance for us. We need to have a very close relationship between the patients, the product delivery service agents, the doctors and the hospital providers. If that can be done together, and especially if we have congresses like this where innovation is given a lot of importance, I think we also would be a part of the team to make things happen very fastly in the market.
And I think the thing that we also are very important and we stress is that we need our consumers to be involved. It has to be an educated populace. And we are striving not just on delivering healthcare, but on educating our patients and educating our consumers through medical education, through patient education, through preventive strategies,
right,
through doing health campaigns. These are not normally, as a disruptive method. Private healthcare companies don't normally engage in these kind of. Yeah, we don't normally, but we believe that delivery of proper healthcare requires us to make that commitment.
Now, I think before I get into the next level of discussion, first of all, I would like to thank the rulers of this country who have a great vision for this country. I mean, if you look at a lot of developing countries, I mean, healthcare, the insurance delivery model is being defined in a different right. And they are the most advanced in all the developments, but they have failed in medical insurance, healthcare delivery system. So I think we are very proud to say that UAE, especially Abu Dhabi, has been very successful in implementing a very successful health insurance delivery system. Now, I think we also need to understand the culture of this country. And for our side, we work in a very high-stress environment. The culture and the high-stress environment should make us more proactive in bringing in innovation into this country. If you look at different countries, the risk is not that as high as what we do in this country, because the norms are so clear that we have our limitations. We have our regulators saying that we are not supposed to do beyond a certain grade of innovation that we are supposed to. So I think there are some cultural issues that we need to tackle, and moreover, the most important thing is about the high stress of work environment that we carry on. But I think of few years of operations in this country, I think we've brought in a lot of innovations which I want to discuss with you.
Sure. And I think there are certain strategies that we, without again revealing too many secrets, we will be providing a difference in healthcare. One of the innovative strategies that we've come up with is providing outcomes measures. Now, outcomes measures in healthcare has not been something that has really been seen in the GCC. Now, it does occur in other places, but even then, it's really not a very robust outcomes measures. We are going to give outcome measures to our patients that they can actually say, okay, you know what, we go to this hospital based on this, they have very low infection rates, they have very successful surgeries. This is something that we will make an educated choice on where we want to bring our family and bring our caregivers.
I think the most important thing is about creating a medical, non-medical team to work as one single team. I mean, there is a lot of difference in the culture that has happened to medical business now. You had earlier professors only doing bigger things, and the new generation doctors were not able to bring in any amount of innovations. But as the way in which the other businesses are growing, healthcare also needs a lot of innovation. For example, now we're talking about integration of healthcare. I mean, starting from the receptionist to the pharmacist, there is an entire cycle of events that happens. And now healthcare facility providers have started time-stamping the whole event. I mean, that is one of the major requirements of the regulatory aspect of this country. We don't want people to unnecessarily wait to get a medicine in a pharmacy, or you don't have to have unnecessary delays happening in the laboratory services. So these are all things which will be considered to be a very important aspect, and innovation in making it seamless have to be the next priority that has to be done.
And I think one of the things we've talked about is, and this is a big data age, healthcare and the electronic health record. This is very important. We've gone to a different level. Most of the healthcare companies in this society, in this country, they just buy an off-the-shelf product. We've actually developed our own proprietary electronic medical record and health record. And the reason we did it is because that's our innovation. We don't want to just take the product that's off the shelf. We want to build a product where, as you said, we are able to timestamp the time that the patient comes here to the time that care is received and the time the patient gets discharged. And we use that data to decrease our medical errors, to provide better care, and to provide better support to our caregivers.
That's right. That's right. And even we do people stamp as well. I mean, so we make people also understand that they're very important in implementing a system like this. So we can promote or we can stimulate people who are not being able to, get to do that advantage. A few of the things which I wanted to mention was about integrating the healthcare delivery systems with finances. I mean, there are many systems and softwares which are available in the market where you cannot build it from a healthcare delivery perspective. So I think the most important requirement for this place is now to get the electronic medical record to be built. So I think we've been successful in doing that, and that's helping us to well coordinate with insurance companies and the regulatory aspects on that side.
Yeah, we've actually built a seamless electronic medical record that seamlessly integrates with our financial record and with our insurance and billing and reimbursement. And we've done it very smoothly. It took it some time. It took work, definitely, but now it really runs very well.
No, I think the government has a very clear plan on the healthcare delivery system for this country. It's not that, there is a lot of private, public hospitals which are coming up, and the unmet requirement situation is getting bigger, because any development needs to have a healthcare support on the back end. And we as a hospital, we as a doctor, we as a team of healthcare professionals need to be more updated. And I think conferences like this would definitely help attracting people from different parts of the world to come to this country and give their best efforts and ideas and technologies to make this healthcare delivery system more efficient and more seamless.
And I think we're benefiting from this country that they are already innovators. They've innovated in many other fields, and now healthcare is the next paradigm and place where we're going to be innovating. And we've gotten support from our government and from our corporate leaders also.
Now, I think I will just give you a small example of how orthopedics was defined 3 years ago. You have a back pain, you have any bone pain, you just need to go to an orthopod. Now, whether it's a shoulder dislocation to a knee problem, it used to be for an orthopedic surgeon. Now, we have people who are well known in the world, who does exclusively shoulder surgeries. So anything on the shoulder, they go to him. Anything on the ankle, there is a specialty for it. In the same way, I think we have people from more than 100 countries coming and living in here with multiple problems. So I think we should be innovative. We should be on the forefront in terms of technology, in terms of efficient, patient, safety-oriented healthcare delivery system. So I think innovation is the key. Innovation is the key, and then R&D has to supplement it, and this is the way to go forward.
All right, so I think we've talked about the topics we want to talk about. We were very glad to be part of this summit.
That's right.
We think this is a very important platform to allow really a mixing of many people from many different backgrounds.
That's right.
To discuss innovation and discuss innovation in healthcare. And we thank our sponsors and our organizers for inviting us to be part of it.